screening colonoscopy has been included in national guidelines due to its presumed ability to reduce colorectal cancer incidence and mortality. The necessary quality control of such a measure requires several parameters to be determined, such as the colonoscopy completion rate and adenoma detection rate, ADR, as well as procedural complications. These parameters have been used in studies and are included in local quality assurance programs in various countries such as the USA, Canada, and Germany. There are various methods of data acquisition within quality assurance programs, including self-reporting in registries or comparative analyses of different databases, for example, hospital and insurance databases. In Germany, a national screening colonoscopy program was started at the end of 2002, accompanied by a large screening colonoscopy database, the Screening Colonoscopy Registry of the Central Research Institute of Ambulatory Healthcare, which includes details of about 4 million screening colonoscopies carried out since the implementation of the program. The data collected in this registry are based on self-reporting by physicians and are not audited. Therefore, the validity of data of quality assurance parameters gathered in this and similar registries is not known. Nevertheless, there is an increasing scientific and public interest in quality assurance data for a variety of medical procedures, including screening colonoscopy. These data even form the basis of hospital and physician guides in public media. In the study entitled Data Quality of the German Screening Colonoscopy Registry, Adler et al. Therefore assessed the validity of the German Screening Colonoscopy Registry with respect to the 3 main quality parameters: colonoscopy completion rate, ADR, and complication rate. Data collected and audited within a previous prospective study called Berlin Colonoscopy Project, BECOP, were used as a reference standard. This analysis was performed as BECOP4 project. Here is a summary of their study. Background and study aims. The German Screening Colonoscopy program is accompanied by a central registry registering the main outcome quality indicators, namely colonoscopy completion rate, adenoma detection rate, ADR, and complication rate. The aim of the present study was to assess the quality of these registry data by comparing them with data from a prospective quality assurance study based on a self-reporting audit and patient feedback of screening colonoscopy. Patients and methods. The completeness of registry information was analyzed by comparing it with prospective data gathered by audit and patient feedback in a previous quality assurance study between October 2006 and March 2008. The main outcome parameters were colonoscopy completion rate, ADR, and complication rate. Complications were recorded in 3 steps in the audit study using case report forms, immediate and subsequent documentation by physicians, CRF1 and CRF2, and patient follow-up, CRF3, but were documented in the registry without differentiation. Results. A total of 12,134 individuals, mean age 64.5 years, 47% men, who underwent screening colonoscopy at 19 private practices in Berlin over the 18-month period were included in the audit study. Patient feedback was obtained for 90.1%. A total of 12,150 cases had been recorded in the registry by the same private practices during the same period. Colonoscopy completion rate and ADR data were comparable in the audit study and registry. Completion rate 98.2% versus 97.7%, ADR 21% versus 20.5%. However, compared with the registry data, the complication rate was 3.1-fold higher in the audit and double when patient feedback was not included. Conclusions. Of the screening colonoscopy quality parameters, colonoscopy completion rate and ADR, but not complication rates, were reliably documented in the German National Screening Colonoscopy Registry. Data on complications need to be appropriately standardized and audited in order to be used for credentialing and benchmarking purposes.